Hello, everyone. Good morning, good afternoon, good evening, depending on where you are in the world. My name is Temi Adegoroye. I'm the managing partner at Sayo Consulting Agriculture Nutrition Limited. Sayo Consulting is a management consulting firm focused on transforming the African agriculture and nutrition landscapes. We work across Africa, but we have our headquarters office in Abuja, Nigeria, with also an office in Lagos, Nigeria, but we work across the continent. Our work really focused around provision of tailored advisory services to various clients in the private sector, as well as development organizations and donors. We also work with civil society organizations, non-government organizations, and include even governments, parastatals, and government entities to really provide consulting advice and policy guidance to develop the agricultural sector across the continent. We also provide a lot of training programs. We focus on building the capacity of emerging and existing entrepreneurs in the food and agricultural landscape across the continent. We also work on designing training programs tailored to the needs of smallholder producers across the continent. Thank you for joining me today. Today, I'll be focusing on discussing the link between food systems and health outcomes and how those two interrelate. On this slide, I would like to say a few things about facts and definitions, around agriculture and nutrition on the African continent. Africa boasts of the world's second largest population after Asia. And we are speaking about, around 17.2% of the world's population are living here in Africa. And there is a rising trend of rural-urban migration on the continent as well. Currently a projected, 44% of the African population would live in urban areas. And that's against about 34% that we recorded in the year 2000. Also, more than half of the population in Africa are smallholder farmers, and that also speaks a lot about the efficiency or the level of efficiency or the inefficiency within our production system. Our food production system is grossly inefficient, and many of these smallholder producers are actually deploying old and archaic methods of production, and many of them have been very slow to adopt improved production practices to increase productivity of food. Also, there's a huge food production gap, of course. I mean, given that many of our producers are small-scale producers and they are not deploying the best practices. Currently, the food system is not efficient, and we currently have a gap that is valued at around over 280 billion USD. More than 50% of the world's arable land, of course, is found here, but we are only contributing very little, to world's food production. When we go to nutrition, about 58% of Africa's population are moderately or severely malnourished. And the trend of malnutrition in Africa is shifting now towards an increase in overnutrition, with obesity increasing more than about 6 times in the reduction in undernutrition over the last decade. So obesity is now a major issue. And the World Health Organization reported the prevalence of obesity has increased by 3 times in adults and by 7 times in children between the period 1975 and 2016. And these figures are really not expected to change except immediate and strategic actions are taken. And as things stand now, no country in Africa is really on track to meet the World Health Assembly target of decreasing the prevalence of diet-related non-communicable diseases by 2025. So I'll move to slide 2 now, just to talk quickly, about the food systems and its components. A food system is the combination and interaction of all actors and activities that are involved, at various stages of the value chain, from supply of inputs to production and all the way down to the last user, who consumes the food. And food systems are sustainable when they ensure the availability and security for all population groups. And when they are resilient, when it's regenerative, when it's inclusive, and also when it's empowering with consideration to climate and environment. And the components of the food system interact to determine the kinds of food that are produced, thereby influencing the diet of a population. Also, the components are also influenced. They also influence the preference, the desirability, and the accessibility of food that we consume. And nutritious foods can be readily available, accessible and affordable. But in the lack of awareness of the importance of healthy diets, the limited purchasing power of consumers, and the non-desire or preference for meals that are, nutrient rich, and lack of time and resources, by consumers. So many consumers are, prone to make poor dietary choices, and this will lead to poor nutrition and health outcomes. Consumer behavior and preference for food choice also affect the food systems. The farmers will prioritize growing foods that have market demand. Food processing, packaging, and retail unit also we prioritize display and the feel of their products, and advertisement and sale of food also that are demanded by the consumers. They most likely will not prioritize nutrition and nutritional outcomes of the food, but rather focus on those things that actually drive demand. So the issues of the food systems are more personal than systemic. An increase in the awareness, demand, and preference of consumers for healthy diets, and more importantly, nutritious food options will directly and indirectly drive farmers. It will drive farmers awareness. Also, it will drive farmers' willingness to even produce the right food. If, of course, we have an increase in awareness, both farmers, seed producers, and food producers will be able to explore innovations to make available healthy options. And some external drivers as well, externalities around climate change, globalization, urbanization, income growth, influence the component of the food system, and they influence several components of the food system, and their outcomes such as the diet, nutrition, and the health of every population. So poor dietary habits particularly have detrimental effects on women and children, and this has been documented by several studies. Studies have shown that poor dietary habits and nutritional status of a mother at pregnancy can expose the child to the early development of chronic diseases, which is called fetal origin of adult diseases. So there are some very serious issues that we can actually pinpoint or pull out from the food system and the functionality of the food systems and how it relates to healthy living and nutritional outcomes. And it's very important for us to keep our eyes on some of those issues to really be able to figure out how to better address issues within the food systems that would lead to sustainable and more desirable health outcomes for the population. And on slide 3, I will talk quickly about nutrition transition and non-communicable diseases. Over the years, the African food systems have changed, with consumers demanding fast, easy, and convenient foods. And the increasing globalization, also has made the different parts of the world to be easily accessible. So this has increased importation of foreign foods, from overseas to Africa, and food practices and consumer behavior also have changed significantly. And it has been projected that in 2050, Africa and Asia are expected to experience a huge shift in the proportion of urban-rural dwellers, with more people migrating into the urban areas from the rural areas. So urbanization, of course, eventually would limit the availability of arable land, extend the food supply chains, and increase food losses, and also increase the access to highly processed, fast, and unhealthy food options. Also, subsistence farmers who are the bedrock of the food systems are also limited. Many of them are too old and fragile, and are often too stressed to meet up with the food demand, So because most of the time, what they produce, like we said earlier on, the production level is actually, very, very low. And because of that, they are unable to actually meet with the food demand option. So cheap street foods that are high in saturated fat are really now the go-to for people. And if something is not done very quickly to really increase the efficiency or improve the efficiency of the food systems, we will realize that this is going to be the trend, going forward. So people, especially people who do not have the ability to actually, to finance themselves, to really access healthy food options, and people who don't even have the time, like, the upwardly mobile, middle income, middle class, basically, they don't have the time. So at the end of the day, instead of going for the healthy meal options, they really have to, go for the high, the food options that are high in saturated fats, and quickly just, have something to eat and go ahead with their daily activities. And, people with high income, also, they also look into fast food more, just like I've said, and they are easily, and because those fast foods are also easily accessible, and, they are time saving. So a lot of people focus less on, the health, impact, versus just, I need something to eat now and really move on. So looking at this trend, you will observe that the changing, food systems, not just for Africa, but globally, is mainly based on individual factors, which leads to consumer behavior. So shift in consumer behavior towards highly processed, high caloric, saturated, fat-filled, sugary and less nutritious options. And, this ultimately translates into poor dietary practices, really, and, an increase in diets related, non-communicable diseases such as diabetics, hypertension, quite a number of diet-related non-communicable diseases that many of these, issues are now resulting into. About 7 out of 10 of all deaths has been recorded that, they result from non-communicable diseases, from many low and middle income countries of the world. And this is really directly, in one way or the other, either directly or indirectly linked to, dietary practices, that are poor, that consumers in those countries are actually making. On the next slide, I would like to talk about, nutrition sensitive agriculture, and, just sort of understand the link between those, between agricultural production and nutrition, and some of the things we need to take into consideration. Many agricultural interventions are focused on, production, with minimal focus, in addressing the other factors in the food system. There are quite a number of factors in the food system, so these interventions can record huge impacts and outcomes, but without the sensitivity of nutrition, they will not really be sustainable from a nutrition perspective. So the framework, on this slide shows the different pathways in which agriculture connects to diet and health, and the nutritional outcomes of women and children. And, this framework can be used to really identify the entry points in which nutrition and health problems can be addressed. And Sahel Consulting, is implementing multiple agricultural interventions, for example, that are really nutrition sensitive. And that will take me to my next slide, just to, quickly, highlight some of the activities of Sahel Consulting. And my first focus will be on, a project called Advancing Local Dairy Development in Nigeria program. We started this program in 2020. And this program is really focused on, we're implementing this program for about 5 years. The program is going to end in 2024. This program is really an intervention that aims to catalyze a vibrant local dairy sector in Nigeria in an inclusive way that improves the livelihoods, productivity, nutrition, and, the empowerment of smallholder dairy households, and the communities where they live. And I would just highlight about 3 core intervention areas under this program. The first one is our training and extension, where, we deploy a behavioral change communication approach, to improve the awareness of women and men within those rural communities on the importance of dietary diversity and improved hygiene practices. So with training them, we have several training modules that we're using to build their capacity and create awareness around, improved dietary diversity and what it will, the good it will do to their households and to the community where they live. The second intervention I would quickly like to highlight is our home garden intervention. So under our dean, we are trying to deliberately promote, access to nutrient-dense crops like vegetables for the smallholder, households by basically training the women on basic practices that they need to raise vegetable gardens within their homes. So encouraging them to actually set up homestead gardens to produce vegetables for consumption, not even for sale now, so that the household, at the household level, they can have access to vegetables. Of course, within many of these communities where we work in the northern part of Nigeria, their food consumption pattern is tilted towards the consumption of more cereal than, even protein and, other vitamin loaded food, items. So encouraging them to produce vegetable for home consumption would actually help them to actually, improve their nutrition status. The third intervention that I will mention, I already has multiple intervention areas, but I just wanted to focus on these three. The third intervention is financial inclusion, and I will talk a bit about policy as well. Within financial inclusion, we realize that many of the farmers that we work with are financially excluded because they are living in very remote communities. They don't even have access to financial services, and they are not even qualified. Many of them are not qualified for, the conventional financial products that are, presented by the financial service providers. So we are making sure that, we're very gender specific, and we're working to introduce women to financial, institutions and savings. And we're empowering them, to contribute, also through access to financial services. They're able to contribute to household, food and non-food expenditure because they are able to save and they're able to make, better decisions in terms of what they use their household income to do and what food products they are also able to access. Because also this means that they will be able to now access, healthcare, in addition to food, but they will be also to access healthcare, and even you have more caring time for their children. And Audi also is working around, a very robust policy component with the relevant government ministries in Nigeria, to ensure that we are able to promote access to healthy dairy products in the country. We want to make sure that the dairy processors in Nigeria can leverage a lot more on backward integration, source fresh milk from the dairy households in place of imported powdered milk in their dairy products. And of course, we believe that will definitely, ensure that the final products from those dairy processors would, meet many of the nutrition expectations of the population. So that's what Aldin is trying to achieve. I'll move very quickly to the next slide to just talk about some of the other programs outside of Aldin. Beyond Aldin, we also have some programs around seed systems, collaborative seed program, and Basics 2. Basics 2 is building an economically sustainable and integrated cassava seed system in Nigeria. And Basics 2 is also focusing on other countries in Africa, including Tanzania. So Basics 2 and collaborative seed program are two programs that are, focused on developing the seed sector and making sure, of course, the seed sector forms a major aspect of the food systems, because if the seed system is strengthened, then it means that farmers would have access to better seeds of improved varieties, of even biofortified crops, of vegetables, and nutrient-dense crops. Even with cassava, we have nutrient-rich vitamin A cassava. So if we fix the seed system would allow farmers to have access to the right varieties to plant, and of course, ultimately that would improve, the access to consumers' access to improved nutritious foods. Also another project that is a bit related to policy is our, FMAD capacity support project, where we're basically strengthening the institutional capacity of the Federal Ministry of Agriculture and Rural Development in Nigeria to ensure that better policies are designed And we are able to also work with them to develop a very strong, and visible implementation framework to ensure that those policies are implemented. And many of those policies are also directly, focusing on driving dietary diversity, driving, nutritious and, the adoption of nutritious and healthy, food options, and making sure that our population is both food secure but also nutrition secure. I'll move to the last piece of the conversation that I wanted to have before I close, and this is really, to basically drive some of this conversation to conclusion. I would say that the food system is in low and middle income countries, or on this underserved populations of the world, it's very complex, and also very sensitive to varying food environments. And there is a need for a multi-sectoral and strategic approach to tackle the issues of the food systems. I would also say that there is a need for policy actions. Of course, a lot of projects are, focused on, improving the policy environment and making sure that it's an enabling environment that supports both the development of the food systems and also, ensure that we achieve the health outcomes associated with the food system. But I would say more needs to be done, around driving policy actions in, to involve, various public stakeholders and private sector actors, to minimize the production and availability of unhealthy food options. Also, generally unhealthy food options are cheaper and they are easily accessible than healthier food options, So households can be supported to grow fruits, vegetables, and legumes, very similar to what we are trying to do through our Howdy program in Nigeria, to promote access to healthy diets and minimize the burden of food purchase on household income. Also, we need to, start addressing the huge individual factors affecting the food systems, which require well-planned and well-structured behavior change communication. We really have to focus a lot on behavior change communication, or what some people call social behavior change communication, to promote the consumer awareness of the importance of diverse nutritious meals for better health outcomes. And I would finally close by saying that COVID-19 has actually presented us with a window of opportunity, more than we know it. Because people have become more aware. People now know that, maintaining immunity and, good health is very critical. So researchers, program implementing partners, donors, and the governments, and even civil society organizations and NGOs would need to harness this opportunity to communicate the importance of appropriate nutritious diets, to maintain health, and of course to achieve a sustainable and resilient food system. By this little contribution, I hope I've been able to help you understand, what the food systems is all about, and how the food system, actually directly, influences the health and nutrition outcomes of the population. Why it's very important for us to drive, through systems change within our food systems in Africa, to ensure that we can actually achieve the nutrition goals and the health outcomes that we've set, for our population and for our countries. Thank you very much. I hope that, this has given someone out there the right information for them to make, decisions. And anywhere you find yourself, within your networks, it will be good for you to also carry this message and make sure that we can actually, drive the true change that we want to see. Thank you very much.